Welcome to our discussion on a topic that many new parents will face at some point: diaper rash. We'll explore why some babies get diaper rashes and provide you with 5 straightforward steps to prevent and treat them. One of our personal experiences involved dealing with diaper rash. First, it's important to know that diaper rashes are very common, and having a baby with one doesn't mean you're a bad parent. However, there are steps you can take to reduce the likelihood of a rash and minimize its duration when it occurs. Let's start by discussing the common causes of diaper rashes and whether they should be a cause for concern. There are 3 main types of diaper rashes. 1. Irritant diaper dermatitis, or irritant diaper rash. 2. Candidal diaper rash, often caused by yeast. 3. Allergic contact dermatitis, an allergic rash. The primary factors contributing to these rashes are moisture, friction, and increased pH levels, which can lead to higher enzymatic activity. The good news is that these rashes are usually easy to treat and prevent. We'll share 5 key strategies to help you manage them effectively. Before we dive into the tips, remember that common diaper rashes are usually treatable with the basic steps we'll discuss. If the rash doesn't improve with these methods, it's a good idea to consult your pediatrician, as there could be other causes that require a closer examination. Moisture is the biggest factor in diaper rash. Modern diapers are designed to hold up to 80 times their weight in moisture and pull it away from the baby's skin. However, once the diaper is saturated, it can trap moisture against the skin, leading to irritation. Studies show no significant difference between cloth and disposable diapers in preventing diaper rash, so the key is frequent diaper changes and ensuring some diaper-free time to let the skin air out. Sometimes, babies may have sensitivities to certain materials or chemicals in diapers. If you notice a rash that doesn't seem related to moisture, try switching to a different brand or type of diaper for a few days to see if it helps. Moisture matters because it creates a warm, damp environment that promotes bacterial and yeast growth, worsening the rash. Prolonged moisture exposure also makes the skin more susceptible to friction and irritants, making it less effective at protecting against further irritation. Urine and stool can be harsh on the skin, especially when mixed, creating a more alkaline environment that activates enzymes like lipase and protease, which can further damage the skin. Babies with frequent diarrhea or those on antibiotics are more prone to diaper rash for these reasons. Interestingly, breastfed babies tend to have fewer diaper rashes, likely due to less irritating stool. Here are our 5 tips for preventing and treating diaper rash. 1. Change diapers frequently. Don't let your baby sit in a dirty diaper. 1. Frequent changes help keep the skin dry and reduce irritation. 1. Overnight. It's usually fine to skip changes for pee-only diapers, but if a rash is present, change them more often. 2. Allow diaper-free time. Giving your baby time without a diaper is crucial, especially if they have a rash. 2. This allows the skin to dry out and heal. 2. Make sure the baby's bottom is completely dry before putting on a new diaper. 3. Use a good barrier cream or ointment. Barrier creams like butt paste or Decidin, the purple one, create a protective layer between the skin and irritants, keeping moisture away and reducing friction. 3. Apply these creams during frequent diarrhea or an active rash to speed up healing. 4. Limit aggressive cleaning. Avoid wipes with scents, dyes, or alcohol. 4. Opt for scent-free, dye-free wipes or just a soft cloth with warm water. 4. If your baby has an active rash, apply a thick layer of barrier cream and consider putting Vaseline over it to reduce the need for frequent wiping. 5. Know when to consult your pediatrician. If the rash persists for more than 3 days despite following these tips, it might require a topical treatment like a mild steroid cream or antifungal medication if it's a yeast rash. 5. A pediatrician can also check for other potential issues like bacterial infections, psoriasis, or nutritional deficiencies if the rash doesn't improve. We hope these tips help you manage and prevent diaper rash effectively. If you have any questions or additional tips, please leave them in the comments below. Don't forget to subscribe to our channel to stay updated with our latest videos. Remember, the information provided here is for educational and entertainment purposes only. For specific medical advice, consult your healthcare provider. Thanks for watching and have a great week. Bye for now.